Hello and welcome to our online training on forensic mental health evaluations. My name is Thalia Werner and I'm the program coordinator for the Collaborative's Forensic Evaluations program. I'm a licensed clinical social worker and I've had the opportunity to work alongside the Collaborative's legal member organizations to conduct mental health evals. My current role at HILSC is to manage a system focused on connecting trained mental health providers to attorneys who request forensic evaluations. I'm excited to work alongside today's presenter, Dr. Jodi Berger Cardoso. Dr. Cardoso is an associate professor at the Graduate College of Social Work at the University of Houston. She has vast knowledge and experience conducting mental health evaluations for individuals seeking a form of immigration-related relief. This online training aims to provide a baseline understanding of how to conduct mental health evaluations in the context of immigration-related cases. We hope you find it useful. So first, let's talk about what a forensic evaluation is. It is an evaluation performed by a clinician for the purpose of providing relevant clinical information to a legal decision maker involved in court proceedings. If you are a clinician and have been doing clinical work for some time, you may be already familiar of some of the elements involved in forensic evaluations because a lot of those elements are similar to those that you would see when you complete a psychosocial assessment. But there's a lot of things about forensic mental health evaluations that are very nuanced. So let's talk about some of the differences there. So let's talk about some of the things that are unique to forensic evaluations. For the purpose of forensic evaluations, you will have or conduct a clinical interview whereby the evaluator compiles narrative information that helps you to understand the client's life, their history, their background, and it gives you insight to their psychological functioning across time. Now, this is similar to when you are conducting psychosocial assessments. However, the difference here is that all of the information that you are collecting should be relevant to the client's legal case or their immigration case. For this reason, the number of meetings that you have with the client are limited, again, because the sole purpose is to produce this evaluation. And the information that you're collecting should be relevant to the immigration case. These evaluations must be done by someone that is licensed to diagnose. We'll talk about that a little bit more. Evaluators must use clinical judgment and a battery of assessments to support diagnostic decisions. We'll talk about why that's best practice a little bit later as well. And finally, evaluations include recommendations in relation to clinical findings. However, it's very important to note that they do not make legal conclusions and recommendations. So let's talk about why attorneys are working alongside mental health providers, or why these evaluations are so important for immigration cases. So first, these evaluations help to support the applicant's credibility. That's very important for legal decision makers and for judges that are, listening to the client tell their story, and your facts that you collect through these evaluations add credibility to the client's story. They provide evidence of requisite level of harm, including persecution, torture, extreme cruelty, and/or substantial harm. These are requisites that are needed in certain immigration cases in order for them to be approved. A forensic evaluation can provide that evidence or serve as supplemental evidence. The evaluation that you complete also helps to document evidence that the client has sustained traumatic experiences that have resulted in psychological harm, such as depression, PTSD, etc. And it helps to put the client's story into context as well. And finally, the story that you write down, that you document based on the client's experience, helps to create empathy about what happened to that person. And it also helps to explain what explain through a clinical lens that individual's response. Why did they behave the way they did? What is happening specifically in their behavior through your clinical lens? And of course, let's not forget about the clinical importance about of these evaluations. When these evaluations are done well and through a culturally competence lens, these assessments, these evaluations can be a therapeutic intervention in and of themselves. Many times the clients that we work with have experienced such complex long-term trauma, and they have, in many occasions, have not had any access to mental health services. So you as the evaluator can often be the first person, the first mental health provider that works with them. And so it gives them an opportunity to engage with mental health services, and it paves the way for them to possibly in the future be open to receiving mental health support as well. Aside from being able to tell their story to someone that is trained in mental health, it also allows them to understand and what mental health services are and what that support can look like for them in the future. So let's talk about legal representation and forms of relief. We are not attorneys doing this work, but we certainly have to have at least a baseline understanding of the forms of relief that are out there. Our immigration system is very complex, and we know and we understand that without an attorney, many of our clients would not be able to be approved for legal relief. And so for us who are interested in taking on this work, we have to have a good understanding of the types of cases that can potentially receive immigration relief. Our legal partners often work with these types of cases, so we want to help you understand what those cases mean and have that baseline understanding so that when you are doing evaluations, you understand how your evaluation fits into the specific legal needs of the case. So our legal member organizations have cases that are for asylum, U visa, T visa, VAWA, and SIJS. Asylum cases are cases where an individual is fleeing from persecution in their home country. When we talked earlier about the requisites of harm, for example, persecution being one of them, your documented evaluation can help talk about how that person was persecuted, for example, in home country. U visas are for victims of crime in the U.S. who have assisted law enforcement. T visa, you might be familiar with if you've worked with trafficking victims, are specifically for victims of trafficking that are seeking relief. VAWA is for a battered spouse, child, or parent of a U.S. citizen or a licensed, a legal permanent resident, and SIJS is for abused, abandoned, or. So let's talk about how forensic evaluations are actually submitted. Depending on the type of case that it is, they are actually submitted through a variety of ways. Some applications actually do not require interviews or going to court. The evaluation is actually submitted as part of an application packet, and it is mailed to a service center. And then someone at that service center reviews the application and potentially approves it. Some forms of immigration relief actually do require interviews, and so the attorney alongside the client will go to the interview. But usually for those submissions, the expert is not asked to be part of that interview. And lastly, some cases actually are approved by immigration judges, and those evaluations are submitted in advance by the attorney and the client, and the expert is asked to be present for court testimony and cross-examination. So you might be wondering, which cases are what? When do I know if it gets submitted or if I have to testify? Well, that lead us to the next topic, which is what pre-evaluation questions, what are some questions that you should ask the attorney? I cannot emphasize enough the importance of having good communication with the attorney that you're collaborating with. We know and understand that communication with our clients is very important, but when you're working and collaborating on these cases, the communication that you have with the attorney is also of the utmost importance, and that actually begins before you even take on an evaluation. So here are some important things to review with the attorney before you make the decision if you're going to take on an evaluation with them. First is, what is the evidentiary purpose of the case? What type of evidence are they trying to collect, and what is going to help them in terms of the information that they need from your evaluation? What expertise is needed to fulfill that purpose? So this is a very important question. You might have training in working with children, for example. You need to know if the child, for example, how old is the child? Do you have clinical experience in working? If it's a 6-year-old, do you have clinical experience in working with children that are very young? Do you have specialized training in therapy for children, for example? So that is very important information to collect. Areas of expertise can vary for clinicians. For example, do you have experience working with victims of domestic violence? And so depending on the evidentiary purpose of the case and the expertise that is needed for that particular case, you may or may not decide to take on an evaluation. And so it's important to collect that information up front. You will also ask if live testimony will be necessary. And that can lead you into having a conversation, a very honest conversation about what the timelines look like for your evaluation, and also the timeline and the deadlines for testimony. Also, I would encourage you to ask about the interpretation needs of the case. Does the client speak Spanish? Do they speak English? Do they speak another language? And so that allows you to prepare and understand whether you will need to schedule with an interpreter as well. You should also ask if funding is available to pay you for your services. I mentioned earlier that the collaborative has a program where we connect attorneys to clinicians, and so we also have a stipend program where we provide low bono stipends for clinicians that are doing this work. So, absolutely ask the attorney if there will be funding that's available for your services. Another important question to ask the attorney if there are any documents that are available for your review prior to meeting with the client. For example, are you able to review the affidavit, the case summary, the client declaration? So some clinicians may choose not to review these documents, others may, depending on the case. And of course, talking to the attorney about what you may have access to is important. And of course, last but not least, are there any barriers to completing the evaluation? Are there any transportation barriers? Is the client in detention? Are there any safety concerns? Currently with the pandemic, a lot of the evaluations are being done remotely, and so you may ask questions about the client's access to technology that would allow you to conduct an evaluation. So questions like that are very important, and all of these questions will help you determine whether you can or should take on an evaluation.
So I'm going to chime in here and talk a little bit about what is trauma in terms of the context of how we think about trauma in forensic evaluations. I am sure that most of you are trained clinicians at this point and have a good sense of what trauma is, but I'm going to do a review of the aspects that Thalia and I think are pretty critical for forensic evaluations, but we will go rather quickly through these slides. Importantly, an important aspect to remember is it's great that you understand trauma as a clinician, but your job is to be able to effectively document the trauma and document the impact of the trauma on the individual. So there's different kinds of trauma. We know acute trauma, for example, is a single traumatic event like a hurricane or an earthquake. In contrast, chronic trauma are experiences of multiple traumatic events. And if you add on that these multiple traumatic events happen across developmental periods, usually multiple developmental periods, then that refers to complex trauma. And complex trauma is likely the most common kind of trauma that you'll see in immigration-related cases, particularly among individuals who are seeking asylum. But there are other kinds of trauma that we don't typically talk about, and that are also important for immigrant families seeking relief. And those are system-induced trauma, and we can see that from the context of children being detained in the Office of Refugee and Resettlement, or adults being detained in detention centers for long periods of time. We see that with people being separated from their children. So it's any trauma that comes at the hand of the government or the state. And then historical trauma is a cumulative emotional harm of individuals across generations. And for me, one of the easiest examples of historical trauma is slavery. One of the types of trauma that we don't typically talk about, but that we see very much in our clinical work, is intergenerational trauma. Intergenerational trauma is transmitted through relationships and across generations. So we see this in the mother-child or the parent-child relationship. And this usually comes across in insecure or disorganized attachment styles. We see, our research has suggested that like maternal PTSD and depression increases psychological distress in children, and that psychological distress may increase their vulnerability for mental health problems themselves, but it may also increase their vulnerability to maltreatment. There are many diagnoses associated with trauma. I think the most common, of course, is post-traumatic stress disorder that gets most of the attention. But all of the disorders on this slide is trauma related. So we see personality disorders among trauma populations. We see somatization, eating disorders, substance use disorders, and other compulsive disorders, phobias, anxiety, bipolar disorder, psychotic disorders, and depressive disorders. All of these relate back to brain functioning, which is significantly impacted by trauma. When we think about PTSD, of course, there are four main domains of PTSD that we typically think about. That's re-experiencing, hyperarousal, negative cognitions, and numbing. In the context of immigration court, it's especially important to focus on justifying the symptoms of PTSD to the diagnosis. So for example, I may say the client experiences symptoms of the re-experiencing cluster, and then I will give several examples of how they meet that criteria. Similarly, I'll say that they may meet the negative cognitions criteria, and I'll use, if I can, direct quotations from the client's experience to describe how they meet the domain for negative cognitions. So it's not enough to say they meet the criteria for PTSD. You have to spell out exactly how they meet that criteria and how they meet each of the criteria within the symptom domains. Trauma impacts the body and the brain, and it's really important for you to understand that you're working in systems that are not necessarily trauma informed. And so explaining in your formulation, in your forensic evaluation, how these different components of well-being are affected by trauma is critical. So of course, one of the most common effects of trauma is the impact on the brain or the memory, but also impact on attention and coherence. So, trauma may impact how a client understands and makes sense of details about what happened to them. Of course, we know that trauma affects the serotonin and neuroepinephrine and dopamine inhibitors in the brain, and that affects mood. We know that long-term consequences of traumatic exposure also contribute to physical health problems like obesity and high blood pressure and cardiovascular disease. And we know that trauma can also affect an individual's understanding and perception of how they interact with the world. And it can also, in individuals who are extremely fragmented, lead to disorganized thinking. In the context of immigration court, it's especially important to focus on the ways that trauma affects the memory. So, this slide is a great demonstration of explicit and implicit memory. And I won't read the slide to you, but take some time to really think about what are semantic memory examples? What are episodic memory examples? What's the difference between, emotional memory and procedural memory? And how can you help lawyers and judges understand that impairment in memory is a consequence of trauma and traumatic exposure? And if you can help judges and attorneys understand that memory is interrupted because of trauma, then it helps them to understand that inconsistencies and details are not a symptom of one's untrustworthiness, but rather they're symptoms of fragmented memory that happen as a result of trauma. One of the things that often gets overlooked in our work in immigration forensic evaluations is the possible impact of traumatic brain injury. I know as a social worker in the field, because of the clinic that I was at, I wasn't oftentimes exposed to traumatic brain injury. That could be very different, for example, if you're working in the Veterans Association or other high-risk populations that have exposure to brain injury. One of those high-risk populations is survivors of domestic violence. And so don't forget to do some basic screening for traumatic brain injury, as survivors of domestic violence and other kinds of gang violence may oftentimes sustain multiple blows to the head over long periods of time. And we know that traumatic brain injury drastically increases the risk of PTSD and depression. We see this a lot in individuals with traumatic brain injury. And we often know that you can have TBI and not necessarily have gross neurological signs. It's very similar, for example, when one may receive a concussion and not know it, particularly in areas where clients may be coming that they don't have access to routine medical screening. Symptoms can persist for years. They can include dizziness and headaches and problem with concentration. And there, of course, sustained blows to the head increase your risk for slow mental processing and impairments and attention and executive functioning. So if you're trying to explain that trauma has impacted the psychological well-being of the client and the sustained blow to the head has impacted the client's ability to focus and maintain attention and has led to impairments and executive functioning, really having a toolkit for screening for traumatic brain injury is really quite important in these cases. And of course, it can help attorneys and judges understand challenges with apathy or impulse control or distractibility or dysregulation. So oftentimes I'll see sometimes clients who have TBI also have significant impulse related disorders like substance use disorders, or they may be homeless and unable to focus and complete basic tasks. So screening for traumatic brain injury should be part of your toolkit in forensic evaluations. So let's talk about the forensic interview and report. I've just given you like a basic screen about what is trauma. From moving forward, what we're going to talk about is how to document trauma in the forensic interview. Before you do this, it's really critical to set up the forensic interview for the client. Don't take for granted that the client is referred to you by an attorney or someone else, oftentimes a legal aid associate. Don't take for granted that they actually understand what the purpose of the interview is and what you are charged with completing as being part of the legal team. And so I always explain the intake process and what it will be like. I let the individual set the pace. So, of course, I have areas that I need to cover, but if a client wants to start with the migration journey and not with the country of origin, I let that client stay and start where they need to start their story. And then it's my job to find the chronology, the chronological order in that, and those experiences. Don't forget, it's really easy when you're doing an assessment or an interview to make it seem like an interrogation. Don't forget your active listening and your empathic language. Just validating the client's experience that what has happened to them is not their fault may be something that they've never received in another interaction previous to meeting with you. So you have the ability to set up for them a good example of what clinical work may entail if they choose to seek services in the future. And always identify your strengths-based perspective, focusing on how the client survived, how they've managed to get to the point that they're at, and how they plan to move forward will help the client realize that what happened to them is not them, it's just something that happened to them. And always assess your nonverbal behavior. I remember in the beginning of this work, I was oftentimes challenged with this because some of the stories that our clients will come to us with are really, really horrendous. They are definitely at the top end of the spectrum for trauma exposure. And so I would really encourage you to just be mindful of your nonverbal behavior, particularly when clients are describing the things that happen to them. Make sure that you're coming across as empathic and non-judgmental. So Thalia, and amongst others, and I have tried to articulate what the different elements are for a forensic evaluation. These are the main components, although be clear that there may be things in this that do or don't apply to your client. And if there are things that don't apply to your client and other categories make sense to you, this isn't a fixed document. It has some flexibility. But there are definite components of the client's life that you want to make sure you discuss. That's definitely the pre-migration experience, the migration experience, the post-migration experience, any experiences with abuse, torture, and trauma, any psychological symptoms and diagnostic symptoms that relate back to your diagnoses. I always conduct a mental health status exam, and I give clinical impressions and observations. There may be some attorneys that will want you to also complete a discharge evaluation as part of your evaluation. Particularly, I see this in cases where clients are being evaluated in detention. So judges want to know when this client is released, what is in place for them, how will their needs be met. And at times, they rely on the forensic evaluator to put together a very basic discharge evaluation plan. And again, this is a very basic plan. It might include resources to address mental health problems, resources to address co-occurring disorders, resources that may address homelessness, basic things that you would do in a needs assessment of any client that comes to your office or place of practice. We tend to encourage the use of assessment measures, and we do this for several different reasons. Part of the reason that we do this is that judges and attorneys tend to like these as an objective measure of your clinical assessment. So of course, you do your own clinical interview, and then the client gives you a sense of their experiences in these sort of objective self-report measures. And then you have effectively, if they converge, you have triangulated your clinical observation with a diagnostic screener. You should be aware that some of these are screeners and not diagnostic tools. So know which one you're using so that you use the right language in the report. So, I use the patient health questionnaire as a depression screener, and then used my clinical diagnostic assessment skills to diagnose major depressive disorder. If you use the Beck Anxiety and Depression Scale, those align more clinically with the DSM-5 diagnoses, depending on, of course, the iteration of the scale that you use, and that might be more diagnostic. So just be careful that you're using the right language. And above always, your clinical assessment is really important, because many of these questions, although their reliability or their validity have been checked across populations, we have considerations of literacy and culture that may not be accounted for in these assessment tools. So just know that some clients these work really well with, and some clients they don't. Particularly non-literate clients, these assessment measures can be really challenging. So I use them when it's effective. It's a nice convergence if the objective assessment aligns with your assessment. And if it's divergent, then it gives you a sense of trying to understand how you're observing the symptoms and how they're perceiving the symptoms, and why your assessment and their perception diverge is a really good clinical conversation that you would want to have anyway. So that's sort of how I think about these assessment measures. And it's important to note that this is not an exhaustive list of assessment measures. These are a few that we've listed that we've used in the past. And again, they can work with some clients and not others. Recently, Thalia and I and other clinicians have begun to really highlight the need for a thorough suicide assessment in this work, because we are dealing with very high trauma within this population. In particular, we're looking at complex trauma, intergenerational trauma, historical trauma, systemic trauma. We're looking at all of these traumas in one individual. We know that kind of early childhood exposure across developmental trajectories can increase the likelihood of suicidality. So be able to identify and establish referral relationships with behavioral health providers in the community, and be proactive and reach out to resources for clients to avoid crises and situations. So we acknowledge that this is not the typical client clinician relationship, because this is not ongoing treatment, but it is both your ethical and your legal responsibility to ensure that clients are safe when they leave you. And if they're not, then the same steps that you would take if a client wasn't safe in your clinic are the same steps that we would really hope that you take in the context of forensic evaluations. And we've listed a couple of resources for you at the bottom of the slide. So as a researcher and a clinician, this is one of the areas that I think really sets apart some of the evaluations that I've done, is my ability to integrate research to support my mental health diagnosis and my assessment of the client. So let me give you an example. If I have a client who I've diagnosed with complex and long-term schizophrenia, and while all schizophrenia is complex and long-term, there is a gradient in terms of how clients can manage the disorder. And so I like to talk, and there are a lot of misconceptions about schizophrenia, that people with schizophrenia are violent, they can't be trusted in community settings. So in a recent case, I was able to cite the percent of people with schizophrenia who become violent. And because it was such a small percentage of all of the people that actually have schizophrenia, and I was able to show that research suggests that it actually having schizophrenia increases your risk of being a victim of a crime, not being the one that commits the crime. I was able to integrate that into the diagnostic summary, into the discharge planning. And I was able to help the judge and the attorneys understand that having a diagnosis of schizophrenia does not increase a public health crisis for others. So it's really important to be able to use research. Another one that I typically get in cross-examination is around malingering. And so I've become informed now about the percentage of individuals outside of hospital settings that actually meet the diagnostic criteria for malingering, and how many and how unlikely that is in the clients that we see, because they are so traumatized, and oftentimes their memory is already fragmented. So I'm able to talk about the high level of intellect it takes to, and integration it takes to malinger, and the percentage of people who actually demonstrate malingering being so small. So I'm able to integrate this into the report, which then decreases the likelihood that that will be challenged in the court proceedings. It's important to remember cultural humility. I sometimes struggle with this, and I'll tell you how I personally struggle with it. I think a lot of people have started to come to me and ask about these forensic evaluations. They perceive that I have expertise in these evaluations. And so I'm inclined then to think that this is an area that I have a lot to offer and can teach other people. But there are some limitations to that. And when you don't see the limitations to your ability, then you can be perceived, one, without cultural humility, but also you can put your client or your potential client's case at risk. And so, for example, I have a lot of expertise and experience with Spanish-speaking clients from Mexico and the Northern Triangle, and even into South America and the Caribbean. I have a lot less experience with clients who are, needing an evaluation because of a custody battle, or needing an evaluation because they have an employment-related crisis. So I almost entirely focus my work on forensic evaluations in the immigration context, and I really keep that expertise narrow so that so that my expertise is not questioned or challenged by other people who may not perceive me as having expertise in those areas. So be really careful to extend your expertise too far, because you can bring to question whether or not that expertise is real. Also, be familiar with your client's cultural background. I've recently been asked to do evaluations on female genital mutilation for clients in different parts of Africa. And I've had to spend some time learning about that and really understanding how that might look for clients, why they're afraid, the different layers, the intergenerational layers of that. So it's not just the client that's afraid of female genital mutilation, but the mother who has then experienced that for their child. And so really understanding the intergenerational and the cultural aspects of particular areas is important to the work that we do. And if you don't feel like you have expertise in those areas, then you do better referring out for those cases. I think also being clear about any culturally based stigma. Clients, for example, that I see oftentimes don't have a challenging time accepting a diagnosis of schizophrenia, and their loved ones may want to use other remedios or remedies to try and decrease the delusions and hallucinations. So really coming into those situations from a very non-judgmental standpoint, and realizing that while your job is to conduct the forensic evaluation, you have an opportunity to connect clients to services that they may not likely receive except through your referral. So spending some time in that area and having some humility and letting clients grapple with the stigma of what they're hearing and what you're talking to them about actually goes a long way in building trust. And that's really important in this context, because you're essentially telling your client, I'm going to meet with you over several appointments, and I need you to talk about the worst things that have ever happened to you. And so you're asking them to be brave, and you're asking them to release all of these horrifying things that have happened to them. So you have to be careful to create a context by which you can receive them. And be aware and try and minimize the power imbalance. That's why I always let clients set the pace. I try not to do evaluations in one sitting. I feel like that can be very challenging for clients with a long trauma history. I also know myself really well. Around hour 3.5 to 4, I myself begin to disassociate if the trauma is really extensive and I'm less crisp, and I don't pick up on some of the underlining insinuations or the implicit communications rather than the explicit communications. So I really don't push myself past a 3.5 hour first meeting with a client. And I'll tell you that I don't typically even push myself if the client is in detention. I will build in time to go to detention twice if possible, because it's just very hard for clients with significant mental health problems to sit there for 6 and 7 hours. So that leads me to a nice transition. There are several areas where forensic evaluations is unique and offers some nuances, and I'm just going to pinpoint some of those, and they're likely gonna stay at the pinpoint and hopefully launch you into further discussion and thinking about how you might interact with these systems. But not all forensic evaluations are the same. Certainly a forensic evaluation done in your office or in the office of an attorney is not the same as a forensic evaluation done in detention. Prison-like conditions are often really terrible. They are, again, part of this systemic trauma of being inside, not having any mobility, not being able to leave. There are time limitations. Also, if you have a client in detention and you hold them for 4 hours, they've likely missed their lunch, which they won't get anything until dinner. It can be very emotionally difficult. There's guards outside the doors. You could get all the way to the forensic evaluation and the client doesn't understand why you're there and doesn't want to see you. Or there might be interference and challenges with physical distance. Thalia and I have talked about oftentimes how we get to a detention center and their first instinct is to put me and the client between a big piece of plexiglass and a plastic phone. So we've oftentimes had to advocate for different conditions in detention centers. And there are a lot of facility restrictions, like you need your ID, you need to be vetted. So these things don't happen overnight. And so I have to keep that in mind in particular because I have a very challenging schedule. And so sometimes I have to shift things around. But when I have an evaluation in detention, shifting things around is really difficult. So keep that in mind when you schedule evaluations in detention. Those appointments typically need to be pretty rigid because it takes a lot to even get you into the detention facility. Again, I went through a few of these. This is a picture of how it may look in a detention facility. I know Thalia has experienced this. I have managed to escape this setting so far, but you need to know that you can't bring electronics, you can't bring food, you can't bring water. You can bring essentially a pen. Bathrooms are outside of detention, so you have to go through multiple checkpoints to even use the restroom. And if you're focusing only on one meeting, this is key. Make sure you really understand the context of the immigration case so that you focus the interview on the areas that are critical for the attorney. So that just may be the trauma pre-migration, migration and post-migration. It might be just the effects of trauma on well-being. It might be the effects of detention on the individual. It might be what the individual thinks will happen to them if they're deported, any kind of diagnosis of functional impairment, and a post-detention plan. For many of you, you may be working with interpreters. That is another level of sort of nuance that you should be aware of. You know, it's very important when you work with interpreters to introduce yourself, to introduce the interpreter. It's very important to clarify your role to the client and to the interpreter. So the interpreter must translate exactly what the client says, and then the interpreter must translate exactly what you say. So it's really important that the interpreter knows that adding in language or taking away language can change the context of what you're trying to do. Avoid compound sentences, use very simple sentences. I do this in Spanish as it is because Spanish isn't my first language. I really try and speak in very direct sentences without many complex thoughts or concepts within sentences, and you really want to make sure you do that during while you're working with an interpreter. And just because you understand spoken language doesn't mean that you're ready to fully be able to do an evaluation in that language. So the thing that you have to ask yourself is, could you hold an entire therapy session in that language, and would that client fully understand you, and would you fully understand your client? And if you can't have that level of complexity of a conversation in that language with your client in a forensic evaluation, then that should be a trigger for you to hire an interpreter. This is definitely a sticking point with me. Clinical and forensic evaluations with children are an entire specialty in and of themselves. You need specialized training in child trauma and assessment. You need experience with child therapy. Some modalities include TFCBT and play therapy. When I did an evaluation of a 7-year-old a few months ago, I had an entire mobile play therapy room that I picked up and moved with me. So that's very important. The other thing is obtaining a full developmental history is critical for the child. Obtaining a full psychosocial history from the parent is also critical. And this is very, very critical. Rushing a forensic evaluation with a child or an adolescent may re-traumatize them. And you may be the one advocating to the attorney to let them know that you will not do a forensic evaluation of a child in one section. In fact, I prep people to expect at least 3. Sometimes I can get it done in 2 with older adolescents, but with kids who are middle childhood or younger adolescents, and an evaluation with a child in one day would take me 8 to 9 hours. And that's just not child-centered. So I guess the take home for these nuanced or special populations, detention, working with an interpreter, and working with children, is just know that those contexts usually require a bit of additional training, and especially it requires substantial training if you're going to do forensic evaluations with children. So now I'm going to talk to you about the latter part of the presentation, which is now that you've completed your evaluation and you've written it up, what are you going to do with it, and how are you going to prepare for the next steps? So the next step, if you plan to testify, and I know lots of people are really frightened about testifying, and it feels very stressful, and it can be really scary. And I do want to normalize that. As many times as I testify, I always get nervous. But I do really see this as a critical piece of how we can advocate and help others understand what we inherently know as mental health providers. And when I'm in court or when I'm on a phone, I oftentimes have the judge interrupt me and say, wait, Dr. Cardoso, can you, okay, so I need you to just clarify this one point, or wait, let me ask that question from my perspective. And that's something that they don't get an opportunity to do in your report. So it's really important that you have the opportunity and not run from the opportunity to provide your expertise in court. A good attorney, a strong attorney, will prep you for that multiple times sometimes. They'll prep you for the hearing, they'll prep you for potential cross, they'll prep you for qualifying you as an expert. And even to this day, there are attorneys that still want to qualify me as an expert, and they want to know how I was trained, and they want to know how am I different than a psychologist, and how can I diagnose, and how am I different from a psychiatrist? So just be prepared to really articulate your role in your profession and what your licensing laws give you access and responsibility to, and stick to that script. No, I don't prescribe medication. I'm not a physician. No, I can't. I can speak generally to the effects of antipsychotics on clients, but I can't tell you with great detail why this particular antipsychotic is not working for the client. That would be the job of a psychiatrist. So I always try and clarify my role. So be prepared to do that for yourself. Ask the attorney what to expect going into court. They generally have a good idea of the judge and of the attorneys that are coming in. And so they can give you an idea of what are some of the questions that the judge and the attorneys tend to focus on. Like, for example, my previous instance of a cross attorney focusing on malingering. Be prepared to discuss questions with the attorney, talk about the order and the flow. And just remember that when you walk into court, it requires a lot of cognitive flexibility on your part. You may have worked this out with the attorney, but the judge may tell the attorney to move it along. Or you may have worked out the piece where you're being qualified as an expert, but the judge may say, well, she's already an expert. So just know that you may have an idea of what's going to happen, but it requires cognitive flexibility in court. The judge may interrupt you when you're in the middle of a sentence, and you want to be respectful and you want to meet the needs of the client. And just remember that and I have to remember this, your disposition and behavior in court is a reflection of your legal team and can affect your client. So as much as you might get upset or frustrated or flustered, to the degree possible, it's absolutely critical that you stay calm. And review your report before you go to court. I mean, I've now done, 30 of these in a 5 or 6 year period. I will have 4 clients that have been from Honduras that have been escaping similar conditions. So it's really important for me to review the case, to review the diagnosis, to be prepared. Remember, you're not walking up there with your report. So if your client has PTSD, you need to be able to talk about the client's symptoms across those domains of PTSD without having the report in your hand. So you may very well need to highlight and practice before you go to court. Just remember, your job as an expert is to provide psychoeducation, to provide an explanation, and to give an expert opinion. You are not giving an expert opinion about the country of origin unless you're an expert in that particular country. You are giving an expert opinion about mental health, about the impact of trauma on that person's well-being. So stick to that script and avoid getting into trouble with, talking about conditions and countries of origin for which the court will not perceive you as an expert. I always try and give explanations. So the client may provide this account, but the client is really disassociative and loses time. And so there is a 2 to 3 year period that client doesn't really remember. And I talk about how that's common in trauma, and we can actually see atrophy in the brain caused by chronic exposure to trauma. And so I really very carefully, very clearly, and very big picture walk the judge and the attorneys through this while I'm on the stand. So I think that's it for me. Thalia will finish up.
Thank you, Jodi. So that concludes our online training on conducting forensic mental health evaluations for clinicians. If you are interested in learning more, please visit our website at www.houstonimmigration.org/projects/forensic evaluations. You will see our webinar series available there for those who are interested in learning just a little bit more on how to conduct these evaluations and best practices. If you are a clinician who is interested in our stipend program or our mentorship program, please contact me directly. My email is thalia@houstonimmigration.org. Thank you.